when I first came here. I really knew no one at the time, but however, one of the physicians here on our staff, her parents and myself were classmates in school. They told me that they really need some more people on the board. I said, and I want to understand, the only pay that we receive is the heartfelt ability that we have of taking care of people who need to be taken care of.
As a board member, we get to look at programs and things we can do that make an impact to better the health of the community. And I like being part of something that I feel like I can make my community better.
One of the reasons that I joined Carolina Family Health Center is to give back. This organization has been so important to the community for a number of years.
The reason that I joined the board is because of the community involvement that they have.
I always sing the praises of Carolina Family. It is well organized. It is not just for those in need. That's the biggest perception that I think is misplaced in the community. It's for everybody, from those that have problems to, heck, myself. I went to the dentist yesterday at Carolina Family Dental Center, which is part of the organization.
From a provider's perspective, the type of care that a community health center model presents to the community, such as Carolina Family Health Centers, directly impacts patient outcomes in a positive way, providing services from preventative medicine, early intervention, behavioral health interventions, nutrition, a mobile unit, dental, just treating the patient from a holistic perspective directly impacts patient health outcomes, because it is true, your zip code can determine your quality of health, unfortunately.
So I've been in law enforcement for probably 27, 28 years. So I've actually had a member or a citizen that was in need of some medical treatment, and they didn't have insurance, was unaware or unsure of how they were going to get medical attention. There were some mental health issues that were going on, and also they hadn't had a physical in about 3 to 4 years. Carolina Family Health was able to provide that, and they're able to get people the medication that they need to be on, which is huge for us in law enforcement, because if you interact with someone who's not on medication, you know, police officers, we're supposed to be trained at everything, but we're not social workers, even though people think we are. They'd be able to have a facility that you could refer somebody to say, hey, you know, this is a place you can go get help. If you're not able to get your medicine, these people will be able to help you or assist you in getting your medicines, which then aids us in not having to deal with that person over and over again because they're not on their medication or in that way like that. So that's why I think in law enforcement, I think that Carolina Family Health Center plays an important part, especially in the day and time now with the way mental facilities are.
One thing I love about Carolina Family is they open their doors to students, high school and college students, specific programs where students can come in and meet staff, have hands-on activities and opportunities where they can be engaged in different careers. I like that we're able to give them a place to come and learn from the experts, and so hopefully they'll join us at a later time.
My affiliation or involvement stemmed back way many moons ago when I was the age of 15, around about 95, 96, and I was afforded a shadowing opportunity through a high school venture. That shadowing opportunity was under the oversight of Drs. Ted and Michelle Wilson, and they were the first clinicians with the first brick and mortar clinic for a Wilson Community Health Center. That experience curated my professional development, and ultimately I went through school becoming a registered nurse. Then furthering my education, in becoming a family nurse practitioner, reached back out to Carolina Family Health Centers, which then had Wilson Community Health Center, Harvest Family Medical, and Freedom Hill in Tarboro, North Carolina. And they said yes to me again, and I was able to achieve my clinical rotations for my family nurse practitioner certification.
And I find it a pleasure to serve on this board. It's very encouraging. It gives me a feeling of being able to help people who are less fortunate than I am And the patient is number one. He's not a number, he's a person with a name. Going back, and unfortunately I can't go back to 30 years, but I can go back 20 years and tell you we do have more doctors available now on the staff. One of the changes is that we have been able to increase our campuses and bring all of them up to date. So we're right above board.
I think it's only going to continue to grow. I really do.